You are listening to Supplement Source, the official podcast of the Council for Responsible Nutrition. And now, your host, Jeff Ventura.
Hello, and thank you for listening to the Supplement Source podcast. I am Jeff Ventura, the Vice President of Communications here at the Council for Responsible Nutrition. I'm just so excited today to have Ariana Gordillo, the Senior Director of Strategic Initiatives from NAFC, which is the National Association for Free and Charitable Clinics, with us. A little background on Ariana and her organization. They have been chosen as a partner for us in our Access Initiative for 2025. I had the pleasure of seeing Ariana at our conference in Salt Lake City, at our Convergence 24 conference, where she wowed the crowd with her presentation. Ariana, thanks for joining us today.
Thank you so much, Jeff. I'm happy to be here and excited to chat a little bit more about, I'm excited to be a part of this new family and partnership, and yeah, thank you so much for having me.
Yeah, I think people were so struck by our chair, Tara, and how she really, I think, did the due diligence in connecting with your organization. She went out and she visited one of the clinics, and it really turned into, I thought, kind of a powerful moment where we really heard about the need to support your efforts. And we heard from your director from the clinic in Salt Lake. For those people who weren't at Convergence, tell me what the clinics do and what did Tara experience when she went there that kind of, I think it really affected her. Tell us a little bit about that.
Yeah, absolutely. Well, first of all, I will say Tara was incredible. Not only at Convergence, but as you said, she really, truly walks the walk. And so she visited, I believe she actually visited a second clinic.
I think so, one in California,
year too.
Right?
Yes.
Yeah.
So she didn't just say, okay, let's partner with this nonprofit and we're just going to say how great we're doing, work with them, awesome. No, she went and visited firsthand to see what the work was all about. So
I think she was joined by our CEO on the California visit.
Yes. Just to back up, we represent 1,400 plus free and charitable clinics and charitable pharmacies across the United States. What are these organizations? So basically, we are the safety net under the safety net. Our clinics and pharmacies receive no federal funding. Maybe a handful of states have some state funding, but it's very minimal. So our clinics are all nonprofits. They see majority the uninsured, the medically uninsured in the country. They provide medical services, health services to people who have no other access, people who otherwise would end up in the emergency room. And so they do this with almost 200,000 volunteers. And they'll have a mix of staff and volunteers. And so they're helping the people who have nowhere else to go. Right now, there are so many millions of people that are uninsured in this country, and we're not even talking about people who may be underinsured, people who may have, for example, Medicaid, but don't have access to dental care. So what our clinics do is they're responding to their community's needs. Not every community may have a particular problem, right? So they come up from the ground up, grassroots in its purest form, and say, okay, we have a problem in our community. How do we help people with public health? And like I said, safety net under the safety net. So our clinics they receive little to no federal or state funding. They use volunteers. They are providing care for people who would not get it anywhere else. So what Tara was able to see was we were able to visit. I went with her to visit a clinic in Salt Lake during the Convergence meeting, and she was able to actually see what the clinic does for their community. We even were able to see a class in action where all of their providers and volunteers were talking about nutrition in that particular example, and how do we reach the people who need the most help in their community in Midvale, which is right in Salt Lake City. she and I were able to walk through every part of the clinic, understand why and how a certain service came about, understand what the clinic was doing to really be a bridge for their community and help people that fall through every crack of our healthcare system. So Tara was I will say, again, I will say the Council for Responsible Nutrition truly walks the walk, and it's not just the talk, right? She was moved. I was with her when we were hearing all of the stories of the various patients that the clinic has seen and helped throughout the years. And she was able to truly get the on-the-ground experience of the disparities, the problems that these clinics are trying to address for people.
And for those who don't know, Tara Martin is our outgoing chair, but just because she's outgoing doesn't mean that the new incoming chair, Bruce Brown, isn't going to pick up the mantle on the Access Initiative. This is something that really, I think, was pushed through and sort of championed by Tara, but it is now something that is going to be executed in 2025. And I think that that's a real fantastic legacy that Tara leaves behind as chair. I'm just really excited to see now sort of it manifest into something that really, impacts real change. Help me understand. So, because I think people who, have health insurance have, even if you've got, health insurance card in your pocket, even people who are insured know that the system's a mess. Mm-hmm. I mean, that not everything is paid for, that, co-pays go up and, premiums, mm-hmm. and that people make triage decisions, even insured people, about what are they going to get their teeth fixed? Are they going to have that elective surgery that maybe isn't covered? There is a sense, I think, a shared sense, even among the insured, that healthcare is tough.
Absolutely.
But it can be life and death for a population that has no insurance cards in their wallets.
Absolutely. I mean, as you mentioned, even those of us that are privileged enough to have insurance, it's not enough to just have a card in your pocket. You still have to pay premiums. You still have to pay co-pays. You still have to deal with your insurance, like I've done recently, where they won't cover a certain medication or any sort of medicine. So we have to deal with that, right? But our patients, I want to share a little bit about our patients. Our clinics and pharmacies serve almost 2 million patients every year. Through 5.7, last year alone was 5.7 million patient visits. Our patients are people who have, again, not just no access to insurance, so the majority are all uninsured, but it's people who have to make the decision every day whether to put food on the table or whether to get insurance, whether to put food on the table or pay rent. They have to make these actual decisions every single day. As you mentioned, even for those of us that are insured, we have to make decisions about whether to forego a surgery or whether to buy the expensive medication that we need or go with an over-the-counter, we have to make those decisions. And even with that, from, I believe, the American Hospital Association said that there's an estimated $220 billion in medical debt just now, right? So that's just for people that are insured. When you're talking about people that are uninsured, it's people that don't have necessarily the ability to see a primary care doctor every single day, right? Whenever I need to, I'm an insured person, I can just make an appointment and see a doctor. But these are people who may be dealing with multiple comorbidities. They are people who may have issues with transportation, may not have access to things like internet access, broadband. It might be people who do not speak the language. people with lower literacy levels. It might be people who have cultural differences that they do not have access to things like you and I may have, right? It's people who have multiple issues too. So it's kind of like when we talk about social drivers of health or social determinants of health, it's not just that they don't have insurance. It's that they may not have insurance, but that means that they also probably have low health literacy. If they have that, they probably also have issues with transportation. So it's not easy for them to get to the doctor when you or I can say, hey, I'm going to leave early to get to a doctor's appointment. They can't do that. The majority of our patients come from working households, and they may have more than one job, and they do not have the privilege to take a day off to care for themselves or go to an appointment. So it's folks that have a lot more barriers in front of them than even we do. And I agree with you. I think even we have our own barriers, but they have a lot more barriers than us. And I mean, as we all know, it is racial and ethnic minorities that have even more disparities, right? And if we're looking at the United States, the United States has about 42% racial ethnic minority composition. Our clinics see 68% of their patients come from these minorities. So we're serving people who really, truly fall through those cracks and have a lot of barriers in front of them.
And one of those barriers, and I think that this is really why we're here and we're talking, is nutrition. We know, well, you tell me what we know, but from what I understand, there are, you were talking about the social determinants of health. I mean, there are places in this country that, from no fault of anyone, it's just where you were born or where you're living. You're in a food desert. You're not getting, access to, healthier fruits and vegetables. Maybe your diet consists of a lot of processed foods or sugar, and that's where maybe supplementation could play a vital role.
Absolutely.
Well,
I will say nutrition, it's a very big deal for our patients because, like you said, there are places that do not have immediate access to or affordable access to first food. Well, let's just start there. As you mentioned, there are food deserts, or a new term I heard recently was a food apartheid, because their companies make decisions not to go into certain areas, right? So what do you do when the nearest option is fast food?
Right.
Do we know how to eat as healthily as possible when you are a diabetic, for example, or you're hypertensive and the only thing around you is fast food?
Right.
Because also, like I said before, there are a lot of our patients have transportation issues. So if there is a grocery store, but it is 10 miles away, and you are not necessarily near public transportation, that is not as easy. It's easier to walk a few blocks to go to get some fast food. So that might be what they have, right? And that's food. But nowadays, I don't know about you, but sometimes getting those organic foods, getting the healthy foods is more expensive.
So expensive. I mean, the grocery bills have just gone up and up and up. And,
Absolutely.
you say to yourself, if I'm feeling the pinch, at the grocery store, and making, and I'm, making decisions about what to put in my cart based on, you can only spend so much on groceries, and then it's sort of like, okay, maybe I can't have, the cornucopia of nutrition that I want to have, but I'm still eating fairly healthy. But to your point, I mean, there is a cost associated with that.
Absolutely.
And I think we think about supplements sometimes as like multivitamins, and we kind of think about.
But it's so much more than that.
But it's so much more.
Yeah.
I mean, prenatals for pregnant women, and bone density and calcium for the elderly. There's just a whole host of specific supplements that people need more when they're not getting it.
Right.
These nutrients from other sources.
Especially if they have chronic diseases, for example.
Yeah.
So, at least for our patients, I will tell you the top 2 chronic diseases that we see are diabetes and hypertension. Especially for our patients, nutrition is so important. And it's not just food, right? You need to supplement that because of cost, because of availability, resources. And so I will say that they need a combination, a balance. It's not just about food. It's all of it, because food is medicine. Supplements need to be part of the equation.
Right.
And so, it's things like you said, vitamins, but yes, but it's there's so much to it, especially like you said, for women's health. Depending on your age, there's a lot that could go into it. And I will say one of the things that struck me recently as a Hispanic woman, that in our cultures, and I want to say I can speak for the majority of Hispanic cultures here, that supplements and natural remedies are much more heavily accepted in our cultures than medicine, which blew my mind. I don't know why I didn't connect the dots earlier, but
I think your director from Salt, his
Yes.
name is escaping me now.
Mauricio.
Mauricio. He was saying, who's a great guy, and he was saying that that he brought that point up on the stage at the conference, that
Yes.
that there is a receptivity to supplements because that is non-traditional,
Right, non-Western.
Yeah,
medicine,
non-Western, right? Yeah, there's definitely more. There's more openness around.
A ton more openness, a
Yeah.
ton more acceptance. As I mentioned, again, racial and ethnic minorities are really the majority of our patients. And so this is already a patient population of people in desperate need that are already, I think that there's much more, like you said, acceptance towards supplements. And I'm not saying that that's the only thing you need, but you truly need a combination.
Well, and you raise such a good point about the sort of specific disease states and conditions. We at CRN do the Supplements for Savings report, and that report looked at these major disease states and kind of analyzed what the cost savings would be to the overall healthcare system if people were taking supplements in a preventive way. So we know that you have the on-the-ground picture, and we have the bigger macro picture, and the idea of sort of helping to bridge that macro problem with the problem that's actually affecting real people's lives on the ground is exciting. Tell me about and we're coming up to our time, but I want to get in the notion that not only is this about donating products. That our members can donate products to the Access Initiative, but there's also options that they're going to be presented with around volunteerism, and also looking at how they can, they could make just a flat donation if they want, a tax-deductible donation. But let's talk about the volunteerism piece, because I think people don't necessarily know what that looks like, but I know there's a lot of interest there.
Yeah, volunteering is a huge part of what our clinics and pharmacies do. So as I mentioned before, there's about, and I only count headquarters, so please know that this number is bigger, but 1,400 clinics and pharmacies nationwide. Through those, we have an estimated 190,000 volunteers,
Wow.
including around 73,000 clinical volunteers, and a whopping 14,500 staff. So volunteering, I only throw those numbers out to paint the picture that volunteering is huge.
Huge component. Yeah.
So clinics need all sorts of volunteers. It can be clinical volunteers, of course, that's one of their top needs always. So if they're, you have somebody with a clinical background, that's fantastic. But there's also, they're needing there's all sorts of volunteering, whether it's virtual or in person. Volunteers around, let's say if you have somebody that knows communications, volunteering with fundraising, volunteering with interpretation or translation, greeting patients, any sort of marketing volunteering. Hey, if there's a skills-based person like you or I, let's say I am a web designer, there are clinics who would love to have somebody help them give a couple of hours of their time, or an hour, whatever it is, and say, okay, this is what I would recommend, or this is how you do this, or somebody who knows social media or something like that. But there's also, if there's somebody in information technology, volunteers can go in groups and help with things like painting, repainting, walls or murals. There's a lot of our clinics have community gardens at the clinic. They can help with that. There's a long list of volunteering opportunities that can be done
in their backyards.
Yeah. Exactly.
That's I think the important thing to note is that no matter where our member companies are, there's probably a clinic not far off. And during the Chairman's Challenge, when we did this the first time, I remember seeing pictures of our members, some from the same company. They were all wearing, they had T-shirts made, and they really kind of made it into a group. They made it into like a group activity
to give back to their community.
Yeah, to give back to their local community, and this is a way for them, to do it. I mean, it's right there for them.
And it's what the clinics need. I mean, they could use you as an individual, or they could use groups. A company can say, hey, let's figure out a week, a day, something, right? It really is whatever makes sense.
An event-based, right.
To come in and have a day where you give back.
Right.
And each clinic has its own varying needs because as I mentioned before, the clinics are truly the community's response to their needs. I have clinics who do outreach events all the time, health fairs. So a company could say, all right, anybody, let's have a group go and help with that, pass out health information brochures, again, greet patients. If you have people who speak Spanish or a secondary language at your company who wants to help doing interpretation for patients. I mean, there's really so many various opportunities that I think organizations can give back in their own backyards. And again, if somebody works remotely, there are virtual options too. So there's a number of ways to give back.
It's time to give back.
Absolutely.
It's time to give back. Ariana Gordillo, thank you so much for joining us today from National Association for Free and Charitable Clinics. I for one, am really excited to see what we're going to do with you next year. Please come back and talk to us again soon.
Thank you so much, and thank you all for the work you do.